Senator Black.
And I too would like to commend Sinn Féin and thank them for bringing this issue in private members' time today. And as we all know, the number of people on waiting lists for essential hospital procedures is really a scandal, and I know that's been spoken about a lot today. We also know that thousands of people are being forced to spend months in pain while they wait to see a specialist or wait for an operation. It saddens me deeply when you think of we are one of the richest countries in the world, and we cannot or will not take care of our most vulnerable, weak and sick. The HSE states that even though the overall length of time people spend on waiting lists has improved in recent years, the total numbers waiting and the numbers waiting in excess of 4 months for outpatient assessment and inpatient treatment are unacceptable and unsustainable are at an unsustainable high. The HSE is working to ensure that no one is waiting more than 18 months for an outpatient appointment or inpatient appointment, and these figures give an idea of the problem. But the personal statements of people in agony while waiting for operations are the most telling criticism of our health service. Families are forced to look at their loved ones suffering, while the better off in society with private health care can access services. A friend of mine whose wife is waiting for an operation, and he told me the effect that it's having on him and how devastated he is, his children, and especially his wife. She has become suicidal, not because she was depressed, but because she couldn't bear the constant suffering and pain. Another friend of mine, and these are all people who are talking to me at the moment, their case, they want to make a case for an opt-out clause to be introduced for organ donations. A Cork mother of two, Linda O'Mahony, called for the government to introduce the opt-out scheme, which means everyone would automatically be an organ donor unless they specify otherwise. The 40-year-old said that she had to be at death's door before she got a liver transplant and is calling for immediate action to try and tackle the transplant waiting times. So I just wanted to ask the Minister today, would he consider or does he have a plan to introduce this scheme? The justified industrial action by nurses, midwives and hospital staff scheduled will have a major impact on waiting times. The grievances of these frontline workers must be addressed as a matter of urgency. And Senator Riley, he mentioned the great work that our nurses do, but the state of our healthcare system is summed up by people who know best, the nurses. The nurses, they do an incredible amount of work, and we have heard comments from them like, all my life I wanted to be a nurse. I love looking after people, but I can't do that as a nurse in Ireland. I didn't realise that my dream would lead me to be a slave. In another post that went viral and appeared in international media, we are so unbelievably undervalued, and we find it difficult to strike in numbers because people may actually die if we do strike, as we are so short of staff. Who is going to look after the dying patients if we strike? The President of the Irish Hospital Consultants Association, Dr. Tom Ryan, said that the public had become immune to the acute crisis in the healthcare system. The thousands of extra hospital beds needed, the waiting lists of over a year, and a serious shortage of nurses and doctors. These indictments of our healthcare system have to be taken seriously and acted upon. If nurses and other hospital staff are prepared to go on strike, then we know the situation is critical. INMO Industrial Relations Officer Mary Rose Carroll said that the conditions nurses are working mean that they fear for their patients' safety. And just on the comment that Senator O'Clougherty mentioned around the addiction services, and I know you're very aware of it, but I will come back to the point that we have 1,500 people who have alcohol, who are in hospitals a day, 1,500 people a day who are in hospitals at this moment who have an alcohol problem. And I do really believe that we could easily lower that if we just looked at the alcohol and what we're trying to do in the public health alcohol bill. It really is an important issue. And finally, Minister, I just feel that questions need to be asked as to why the number of senior managers in the HSE has grown by almost 40% in the past 4 years, since 2012, and that hospital wards are often understaffed due to the severe curbs on the recruitment of nurses and doctors. And I just think that's scandalous that we have 40% an increase of senior managers in the HSE. There's something not right with that picture.
Thank you very much.